My name is Ayalo Helen, an administrator at Ogano Wellness Center. Ogano Wellness Center is located in Akisim, Engulu Road. In Ogano Wellness Center, we do treat different kind of patients. We do deal with stroke persons or patients. We deal with people with back pain, muscle tension, people who have gotten an accident and have muscle pull. We deal a bit with bone issues if you have a dislocation with bones. And we do carry out the following activities: chiropractic and physiotherapy. In Ogano Wellness Center, as I said earlier, we deal with the stroke patients. And stroke patients, this is under chiropractic. Then in physiotherapy, we do body balancing and body fitness. If you feel you want to lose weight, we welcome you to Ogano Wellness Center. For more information, you can contact us on 0765 163 945 or 0782 633 879, as we welcome in the doctor to come in with more information for our health. Thank you. Be blessed.
Dr. SEKABIRA Tony, my name's. I'm a chiropractor doctor, a physiotherapist, fitness instructor, as well as a nutritionist. Today, let me talk about stroke. There are two types of stroke. We have ischemic stroke and we have hemorrhagic stroke. Now, when it comes to stroke, I reverse the stroke by doing chiropractic, that is nerve stimulation, in that I reverse the stroke and I get a person to the way it used to be. I restore that person's health. When we talk about ischemic stroke is when there's insufficiency of blood flow to the brain, whereby someone gets a tumor that a person, the nerves die out and the person can't respond. The tongue becomes flabby and the body gets paralyzed. In other words, ischemic stroke is all about pressure. That is hypertension. So what happens when the people come here at Ogano Wellness and Rehabilitation Center, what we do here, we have different machines that help in nerve stimulation. On top of that, we have medicine, regenerative medicine, that helps in movement of blood or saturation of blood. Because when it comes to saturation, or when it comes to cardiovascular, that is the heart as well as circulation, we need to reverse the stroke in that the person will stabilize the pressure the way the person is supposed to be, and we do the stimulation. By doing so, a person can get a change within 1 month, 2 months, 3 months, or up to 6 months, according to the body, because our bodies don't respond the same as far as treatment is concerned. Now, when we talk about hemorrhagic stroke is when a vein ruptures or a vein bursts. With that, I give regenerative medicine as well as doing nerve stimulation to work upon the saturation and that paralysis. Then on top of that, after doing the stimulation, we do physiotherapy. Now, that is all about the impairments. We do the physical part of it, whereby we train a person to get back to his form, the way he used to walk, the way he used to sit. And on top of that, we work upon even the speech impairment, because when a person gets stroke, automatically a person can't talk like the way he used to. The tongue becomes flabby and he or she can't talk. So what we do speech therapy, whereby we train a person on how to speak. On top of that, how to walk like the way he used to. As testimonies, because in this place we have more than 20 testimonies from Ogano Wellness as well as Rehabilitation Center, whereby we have rehabilitated many conditions. Not only stroke, but people even come here whereby they have posterior. Posterior, that is a dislocation of a disc. Like I can say posterior of the L3, L4, that is the lumbar spine as well as the sacral spine. You find that when a person comes here, because there's that dislocation of a disc, at times it even goes beyond, whereby a disc has to wear. So when it wears, we give regenerative medicine. Then we use different equipment, so machines, in that we can push back the disc the way it used to be. Because if a disc moves from its position, automatically a person is going to get weak limbs, or the legs are going to get paralyzed. Some people can't walk, some people are on crutches. So what we do, we reverse. We get from the main root cause, that is the disc, we push it back the way it is supposed to be, then we work upon the nerves, because automatically, if at all a disc has moved from its position, there is going to be compression of the nerves, because they can't sit anywhere. So by doing so, we reverse by treating and stimulating those nerves, in that at least they can respond to the body the way the person is supposed to be. Not only that, there are so many cases that we treat here, like cerebral palsy, like DMD, that is Duchenne muscular disease, whereby a child can't move. From childhood, a child has weak limbs. A child the tongue is flabby. Not only DMD, but even ADHD. That is attention deficit hyperactivity disorder. Nowadays, in this age, you find that many children they are battling with ADHD, whereby there is saliva coming out, a child can't respond, a child is there, a child is retarded. So what we do here, we do, as I told you, stimulation. We give regenerative medicine, in that we can work upon the brain, because it's all about the brain. You find that so many kids, from the time the mother conceives, from the time of birth, the mother maybe didn't consume much of nutrients and what have you. So we keep on giving the regenerative medicine, that in that child can get the nutrients that he or she missed out by the time birth was given. So we do, there are so many cases that we attend to, but more especially when it comes to, like, many people here, they are people are amorphous, people are obese. You find that people need to lose weight. People come here when they're having big tummies, whereby we can give different concoction according to body types, because we have 3 body types. We have people who are ectomorph, those are people who are thin and slender, whose metabolism is high, and for them they need to at least increase on their weight. Then we have people who are mesomorph, people who are muscular, whereby they need more of toning. Then we have people who are endomorph, those are people who are obese, people who are huge, people who are fat. So when they come here, we give them a concoction and we do fitness exercises, or we give them exercises, in that at least they can cope up according to their BMI, that is body mass index, because we don't just mere shade off the weight, but it's all about the healthy weight. So there are so many cases that we handle here. Thank you so much. May God bless. Just know that when you come to Organo Wellness and Rehabilitation Center, all will be well. May God bless.